doctors and nurses at this hospital will be joining the strike today because they say France's public healthcare system is in crisis and patients' lives are at risk. Now, over the weekend, we saw 660 doctors, including a few who work at this hospital, putting their names to a public letter warning the government extraordinarily that they will quit the public healthcare system altogether unless more money is found for French healthcare very quickly. They remind us that since 2005, 9 billion euros have been cut from the health service, and that means in hospitals like this, there are fewer beds available. There have been particular problems in accident and emergency where people have had to wait for several hours to see a doctor. All of that adding pressure to doctors' workloads, meaning that many of them have been migrating to the private sector, where, of course, they're better paid, as we've seen wages stagnate here in the public sector. Now, this is all a very far cry from the situation just 20 years ago when the World Health Organization said that France had among the best healthcare systems in the world. Today you talk to doctors and they tell us that austerity and cuts have left them in a very difficult situation indeed. That's why they're joining these broader public strikes today. And as you said, there have been rolling strikes among healthcare workers since March, but they're hoping that they can capitalize on the broader strike movement to draw attention to some of the problems that are taking place within public healthcare here.
Now, Nadia, of course, this mass protest in the street today comes on the 13th day of that strike that has actually shut down almost all of the country's transportation system. Are we any closer to a breakthrough?
Well, negotiations will resume tomorrow between unions and political leaders. But I think today the protests in the streets are a real litmus test for how much power this union movement continues to have, which will perhaps impact those negotiations tomorrow. It is not just doctors and nurses and, of course, transport workers that are on strike today, but also firefighters, teachers, public lawyers as well. They're all taking to the streets because they're very concerned about the pension reforms that this government is trying to push through, standardizing those 42 individual pension systems into one single system, meaning that people will have to work slightly longer into retirement and in some cases lose some of their retirement benefits as well. Now, it'll be a real question as to how many people turn out into the streets today. On December the 5th, the first major day of protest action, there was somewhere between 800,000 and 1.5 million people taking to the streets across France. Will there be as many today? Will we see, as a result of the chief architect of France's pension plan being forced to resign amid a scandal yesterday, will that propel more people out into the streets, or will we see, because we are just a week before Christmas and public pressure appears to be turning slightly away from those in the streets, that perhaps we'll see slightly fewer people today? Time will tell, but certainly the union's hoping for a big show of force against the government before those negotiations get underway again tomorrow.